Have you noticed that ever since you started wearing hearing aids, your ears seem to produce much more earwax? You're not imagining it. This is actually a very common problem among hearing aid users. Extra earwax can reduce your hearing, cause annoying whistling sounds, clog your hearing aid, and sometimes even lead to ear infections. The good news? Most of these problems are completely preventable. In today's video, I'll explain why hearing aids cause more earwax buildup and why it happens. You'll also learn the warning signs you should never ignore and simple ways to keep both your ears and your hearing aids working properly. Hello everyone, I'm Dr. Tien Tran, an ENT specialist. One of the most common reasons hearing aid users visit my clinic isn't because their hearing aid is broken. It's because earwax has blocked either the ear canal or the hearing aid itself. Many patients believe their hearing has become worse. But after a simple ear examination, we often discover the real problem is just a large plug of earwax. To understand why this happens, let's first talk about what earwax actually does. Many people believe earwax is dirty and that removing all of it is a good thing. In reality, that's not true. Earwax is an important part of your ear's natural defense system. Earwax helps moisturize the skin inside your ear canal, keeping it healthy and preventing dryness. It also traps dust, dirt, and tiny insects before they can reach your eardrum. Even more importantly, earwax contains natural substances that help fight bacteria and fungi. In other words, earwax is not your enemy. It's one of your ear's first lines of defense against infection. A healthy ear also cleans itself. You usually don't need to remove earwax very often. Every time you chew, talk, or move your jaw, old earwax slowly migrates toward the outside of the ear canal. Once it reaches the outer ear, it naturally dries, breaks apart, and falls away on its own. So, why do hearing aid users often develop more earwax buildup? There are 4 main reasons. Reason number 1. Hearing aids block the ear's natural cleaning process. A hearing aid, or an air mold, sits inside the ear canal for many hours every day. This partially blocks the natural pathway that earwax uses to move outward. Instead of leaving the ear naturally, the wax becomes trapped inside the canal. Over weeks or even months, that trapped wax can build up into a solid blockage. Reason number 2. Wearing hearing aids can gently stimulate the earwax glands inside your ear canal. These tiny glands normally produce earwax to protect your ears, but constant stimulation may cause them to produce even more. Not everyone experiences this. However, many hearing aid users notice that their ears produce wax more quickly than before. Hearing aids create a warmer, more humid environment inside the ear canal. That extra warmth and moisture can soften earwax, making it stick to the hearing aid and the ear canal walls. If the hearing aid isn't cleaned regularly, this moist environment may also encourage bacteria and fungi to grow. Reason number 4. Most hearing aid users are older adults, and aging changes the way earwax behaves. As we get older, earwax often becomes drier, harder, and less likely to move out naturally. When dry earwax combines with a hearing aid that partially blocks the ear canal, impaction becomes much more likely. So, how can you tell when earwax is becoming a problem? Watch for these warning signs. You may notice that your hearing suddenly becomes less clear, even though your hearing aid is turned on. The sound may seem quieter than usual. Even with fresh batteries or a fully charged device, your hearing aid may begin to whistle or produce feedback more often. You might also feel fullness, pressure, or persistent itching inside your ear. These are common signs of earwax buildup. Earwax doesn't just block your ear. It can also affect the performance of your hearing aid. Wax can clog the tiny microphone openings, making it harder for the hearing aid to pick up sound. It can also block the speaker, reducing the volume and clarity of the sound. Many hearing aids also contain small wax guards designed to protect the internal components. When those wax guards become blocked, your hearing aid may suddenly sound weak or stop working properly. In severe cases, moisture mixed with earwax can even damage the electronic components inside the device. This is one of the most common reasons hearing aids require maintenance or professional repairs. How to prevent earwax buildup. The good news is, preventing earwax problems is much easier than treating them later. Let's look at a few simple habits that can help keep your ears and your hearing aids in excellent condition. First, clean your hearing aid every day. Use a soft, dry cloth to wipe it clean. Remove any visible earwax using the cleaning brush provided by the manufacturer. Never wash electronic hearing aids with water, as this may damage the internal electronics. Next, replace the wax guards regularly, following the schedule recommended by your audiologist. Fresh wax guards help keep earwax from blocking the speaker and maintain clear sound quality. If your hearing allows, remove your hearing aids before going to bed. This gives your ears time to breathe. It also reduces moisture inside the ear canal, creating a healthier environment for your ears. Avoid using cotton swabs inside your ears. They usually push earwax deeper, not out. That can create larger blockages and make professional removal more likely. If you wear hearing aids every day, schedule routine ear examinations with an ENT specialist every 6 to 12 months. Some people naturally produce more earwax and may benefit from more frequent professional cleanings. Don't ignore persistent itching, pain, or ear drainage. These symptoms may indicate an ear infection or a fungal infection. You should see an ENT specialist if your hearing suddenly becomes worse or your hearing aid keeps whistling. Also seek medical care if you have ear pain, drainage, or repeated problems with earwax blocking your hearing aid. If cleaning your hearing aid doesn't improve your hearing, don't assume the device is broken. The problem may simply be a plug of earwax that can be removed safely by an ENT doctor. Never use ear candles or sharp objects to remove earwax at home. They can seriously injure your ear canal or eardrum. Remember, earwax is not your enemy. It's an important part of your ear's natural protection. The goal isn't to remove all of your earwax. The goal is to prevent excessive buildup. With proper hearing aid care, good ear hygiene, and regular ear examinations, most earwax problems can be prevented. If you found this video helpful, please give it a like, subscribe to the channel, and turn on notifications. Do you wear hearing aids? Have you ever experienced earwax buildup or itchy ears? Share your experience in the comments below. I'd love to hear your story. Thanks for watching. Take care of your ears, and I'll see you in the next video.